Dr. Leone then told us about some of the most exciting research advances for breast cancer brain metastasis.
One of the most recent presentations have been the data from a clinical trial called Destiny Breast 12, which is a trial that evaluated a medication called Enhertu, or trastuzumab deruxtecan, for patients with brain metastases that were either stable or progressing. And that clinical trial has shown a very high efficacy of that drug for patients with brain metastases. Prior to the reporting of this study, there were a few smaller prospective and retrospective studies that have shown efficacy of this drug in brain metastases. But the larger clinical trials that led to the approval of Enhertu in clinical practice had excluded many patients with active brain metastases. And there was still the question among the community as to whether this drug would be a helpful option for patients with brain metastases, particularly brain metastases that were active or growing at the time of starting treatment. And in fact, this study shows that indeed it is, and the efficacy in the brain was very similar to the efficacy outside of the brain.
In general, Dr. Leone was excited about the potential antibody drug conjugates like Enhertu will bring to patients with brain metastasis.
There are other antibody drug conjugates that are being studied and many that are in the pipeline. It's remarkable how the field of antibody drug conjugates has evolved over time and has really become front and center on many of the research efforts. And so there is a question as to whether different targets may also be effective for the treatment of patients, both with HER2 positive and especially with HER2 negative breast cancer, as well as treatments that use, or antibody drug conjugates that use different payloads, as we call them, which is the active drug, the active chemotherapy agent that will go to try to kill the cancer cells. And so we certainly look forward to the studies that are being done with antibody drug conjugates beyond trastuzumab deruxtecan or Enhertu to see what other options may be helpful for patients as well.
Dr. Leone also walked us through some exciting clinical trials aiming to improve outcomes for breast cancer patients with brain metastasis.
We have several studies that are open currently that are looking at different questions that I think are very important. And this includes many areas within brain metastases. One, for example, is a question about screening for brain metastases. And there's a clinical trial to try to assess the utility of screening patients to see if they have brain metastases when we're doing our treatments for breast cancer. Another study is looking at an option of dedicated radiation therapy, but to more than 5 lesions in the brain, which is an area where historically with multiple lesions in the brain, we have thought about doing whole brain radiation. And this clinical trial is trying to assess whether doing dedicated radiation, even if the number of lesions is higher than 5, could be a safe option for patients with brain metastases that are ongoing. And we have also a trial that we're excited about testing tucatinib, which is one of the recent developments in patients with brain metastases, but testing tucatinib to see if we can add it to the existing treatment that a patient is receiving and help prevent progression in the brain for those patients.